Welcome back to the City Current Radio Show. I'm your host, Jeremy Park. We're honored to be joined by our next guest, Dr. Lemetra Scott. She's the CEO of Breaking the Sickle Cell Cycle Foundation. How are you doing, Dr. Scott?
I'm doing well. Thank you so much for having me on this nice, warm, sunny, hot July day.
Absolutely. Well, let's dive in. Before we even get to the organization, let's start with a little bit of education around just what sickle cell is. So
Okay.
talk about what sickle cell disease is and the prevalence, and then we'll dive into the work you do.
Okay. Well, sickle cell disease is a genetic blood disorder. So it's not something that people can catch from somebody else. It's actually something you're born with. And the way that you get to be so lucky to be born with sickle cell disease is when both of your parents carry the trait that causes sickle cell disease. So when both parents carry the trait for the disease, there's a 25% chance that the child could have sickle cell disease. There's a 50% chance that that child could be a carrier of the trait. And then there's a 25% chance that nothing will happen and your child will be normal. The only thing is, it's kind of like a roll of the dice because we don't know what that fate is until that fate actually has occurred. And then we're kind of behind the eight ball and trying to rectify or either live with what the outcome is in terms of sickle cell disease. As far as prevalence goes, sickle cell disease does actually affect minority populations more so than others, but that does not mean it only affects minority populations. And I want to say that is one of the most important takeaway messages from this, is that you can't look at a person and say, well, they don't fit the description of what a person with sickle cell disease looks like, or their ethnic group doesn't match what a person with sickle cell disease looks like. Because lo and behold, sickle cell disease actually follows the prevalence of malaria. So that's how we got here with sickle cell disease. Is once upon a time, what used to be considered a protective mechanism of people who carried the trait for sickle cell disease, they actually didn't succumb to malaria. They were actually able to survive. So what was once something that was a good thing in nature, being that you were able to survive malaria, those two people with that survival mechanism, when they have a child together, they have the risk of having a child with sickle cell disease. So when we talk about prevalence, we know, of course, that it affects African Americans, but in that same vein, it also affects people that are Hispanic. It affects people from Central America, South America, the Mediterranean areas where we have Turkey, Italy, Greece, and even Southeast Asia. So when you talk about prevalence, there you have it. It's a gamut of, where it could be, while it may affect some ethnic groups more than others.
Well, I like the history lesson too of the malaria and tying that in as well. And the reason it's called sickle cell disease is because normally the red blood cells are more round. And in this case, they're shaped more like a sickle or kind of like a crescent moon. Is that correct?
That is exactly correct. And all of that happens because of the red blood cells. They are not formed in the correct circular round donut shape like they should normally be. But in sickle cell disease, they do take on that crescent moon shape because they do have that defective gene in them. And that crescent moon shape is basically what causes all the problems for sickle cell disease. Those crescent moon shaped cells, they are hard, they're sticky, and they like to stick together. They stick to the inside lining of the blood vessel walls. And when they do that, they actually can form blockages. And those blockages form, and it is associated with excruciating pain. Not only is it associated with excruciating pain, it's also associated with organ damage, stroke, and even death. So sickle cell disease is something that is very, very serious. And it's something that you really want to know about in terms of what's in your genetic makeup. We have a tagline that we use, and it's called "What's in your genes?" Not the genes that you wear, but in your DNA and your genetic makeup. What's in those genes? And do you have something that is contained therein that could be responsible for causing this detrimental disease?
Let's dive into the work that you're doing, because education and awareness, just like we're talking, is a huge piece of this. But like you said, it's something that it can be hard to get in front of. And yet that's kind of the goal, is how do we get ahead versus always fighting from behind? So talk about your efforts on your end.
Okay, so I started Breaking the Sickle Cell Cycle Foundation back in August of 2015. So we've got a birthday coming up. It'll be 5 years this year in August. And when I started the organization, the main goal was to promote and provide awareness about sickle cell disease, because a lot of people don't know. Education, one, we make people aware of the disease, but also we make them aware of what they can do to prevent the disease. And then we talk about prevention. So the first thing in terms of how do we prevent sickle cell disease is that we educate ourselves about what's in our genetic makeup. And that's one of the services that we offer to people. Normally we would have, this is a big time for community outreach, but because of COVID, the community outreach is a little bit different this year because we're not able to gather in large groups, and I'm not able to go out and talk to people and perform sickle cell trait testing, which only requires a simple blood stick. So it's a small blood draw. We do finger sticks, and those samples are processed through the Meharry Sickle Cell Center. So that's the first step in how we prevent the disease, is one, we educate ourselves about what's in our genetic makeup. The next thing we can do to help with prevention of the disease is, one, now that we know, it's not only important for one person, because it takes two people to have a baby. So both people need to be aware of what their sickle cell trait status is. And at that point, you can begin to make decisions regarding family planning. Does that mean, one, some people decide to roll the dice. They say, well, I know what my chances are. It's only 25%. So I'll just roll with whatever happens. Then we have those that decide, well, no, I don't want to take the chance at all, because they understand just how serious sickle cell disease is. So they decide, no, I'll just rather adopt, or we just won't have children. And then we have something that's called pregestational determination. That's a process whereby two people, if they have the trait that causes sickle cell disease, you have to go through a couple more steps, and it's more so of along the lines of in vitro fertilization. So that way you can have the sperm and the egg fertilized, and you look at it, look at the embryo under a microscope, and you get to determine, you know, which of those have the trait or the gene for sickle cell disease, which ones don't. The ones that don't, you take that embryo, because you now know because of the pregestational determination process, you now know that that embryo does not have sickle cell disease. You implant it back into the uterus, and you have your baby free and clear, and your baby doesn't have sickle cell disease. I know I broke it down and made it seem real simple, but as you know, with the in vitro process, it's not that simple. But that's basically the gist of how we can prevent future children from being born with sickle cell disease.
Yeah, I mean, you know, to your point, it's not that easy, but it's using science. And to your point, it's giving your child a huge advantage that instead of just blindly going in, now you're saying, okay, I want to do what's best for our child and make the best decision. And now at least every step of the way, you're educated and you're informed, and then you can do what's best. And that's a huge piece of this. Talk about on your end, you know, outside of that component, a lot of the other efforts, because you mentioned right now, COVID-19 is forcing some changes, but it's awareness, it's education. It's also connecting the healthcare community together and having more meaningful conversations. So there's a lot of layers to what you're doing.
So yeah, especially in the healthcare community, you know, that's my, I guess you call it, of course, that's my bread and butter, but also that's also the place where I feel like I can effect the most positive change in the circle that I do have. So unfortunately, with sickle cell disease, like I said before, it's associated with excruciating pain. And because there is no universal cure for sickle cell disease, and we just recently started to tap into therapies that may help with prevention of those pain episodes, but it's still all brand new. So the mainstay of what we've been using to control that pain is narcotics, unfortunately, narcotic medications and opioids. And because these people, like I said, they're born with sickle cell disease. So it's not something that you develop later on in life. That means these people have been dealing with this pain from birth, and they've been prescribed narcotics most of the time from a very young age. Those young children grow up to be adults. And when those adults go to seek care within our healthcare system, and they show up at an ER because they're having a pain crisis or a pain episode, and they request specific narcotics, people who, and healthcare providers too, that don't understand sickle cell disease, they oftentimes begin to label these patients. They begin to label them as drug seekers because they came in wanting a specific narcotic medication. They won't back down. They're very adamant about getting their pain meds. But what you don't understand, if you don't understand sickle cell disease, is that they're not all, they're not seeking drugs. They're there because they're in pain and they need help. And as a healthcare professional, you do a disservice to this particular patient population if you don't go that extra mile to learn about sickle cell disease and understand. So that, in addition to what I do in educating the community, I also reach back and I perform educational seminars, I guess you could call them, or now we call them webinars because we have to do it all on Zoom. But that's another place where I go and educate healthcare professionals about sickle cell disease, what the disease is and how we treat it and how your patients may present. So this is a time where we can first do no harm to sickle cell patients by educating ourselves. And that is, the number one, that's how the Hippocratic Oath begins, that all healthcare professionals take, and is to first do no harm. So I would encourage anyone, especially if you are in an area that services populations that are heavily affected by sickle cell disease, to do justice, do your due diligence, and start to educate yourself about sickle cell disease. And don't rush to judgment. Please don't rush to judgment. In my mind, and the way I look at it, I told you that a sickle cell episode is associated with excruciating pain. So when, as you know, my son has sickle cell disease and he's 7. And when my son explained it to me about what the pain felt like, and this was probably when he was about 3 and he was going through a pain episode, and he said it felt like a jackhammer that beats on the street. That's what he said it felt like on his legs, a jackhammer. So I asked adult patients, what does a sickle cell pain crisis feel like? And they said it feels like broken glass that's flowing through your veins. So when you think about those sickle cells in their heart, and you know that a crescent has pointy ends on it. On both ends, it's very pointed. So those pointy ends are scraping up and down the blood vessels. So that's exactly how you can describe it, or an adult would describe it as the feeling of broken glass just flowing through your veins, scraping along the way. So that's some excruciating pain. So needless to say, when they show up in the emergency room and they need help, and the healthcare provider is not providing it to them because they don't look a certain way, we are definitely doing a disservice to this patient population. And it builds distrust from the patient side. So they would rather stay home and suffer than to be subject to ridicule and bias and judgment when seeking help from our healthcare system. While they're doing that, they put themselves at increased risk for organ damage and death. And unfortunately, for our young adult population, they do have a high prevalence of death rate between the ages of, I would say, 25 to 40.
I'm glad that you're sharing the story of your son and what it feels like, because I think that's a really important piece of this, to realize, like you said, what they're experiencing and to have some empathy. And when you see someone who's in pain like that, one, just not rushing to judgment, like you said, but 2 is understanding really what they're experiencing through no fault of their own, and how do we help them and get them help, and for them to be able to remove that stigma and go in and get the treatment that they need, I think is so, so important. Share how we as a community can help, because I mean, obviously educating ourselves is a big piece of this, but talk about the ways that we can help you.
So right now, what we're doing is adjusting to our new normal, and we are looking at new ways of providing outreach. So a lot of the families that I have been in contact with, because of COVID-19, they have not been able to work prior to where we are right now, where people just now started to go back to work. But a lot of them, they weren't able to work, and the kids have been home since March because school has been out. So with that being said, they needed food. So one of the things that we've been doing, we partnered up with Global Blood Therapeutics, and we've been able to provide food vouchers for the families during this time that we're in. But one of the bigger things that we're looking at right now is what's going to happen in September, we're August now, when it's time for school to go back. I talked to you about organ damage. Well, the spleen is heavily affected by sickle cells, and the spleen is responsible for filtering out bacteria from the blood and things that could cause infection. Well, that means a person who has sickle cell disease has a compromised immune system. So now we're going to take a child who has a compromised immune system and put them back into a school setting where COVID is running rampant everywhere now. And that's a major concern that we have. So we are in partnerships with another company right now in getting back to school kits prepared that will actually, we're calling them wellness kits. But things that will be contained in those kits will be things that help the students be safe during the school year. September is coming up. It's Sickle Cell Awareness Month. And we do have a project that we're working on with another organization and Be the Match. It's called Couch to Cure. So in that case, we are looking for bone marrow transplant donors who will do cheek swabs, because the bone marrow transplant is the only cure for sickle cell disease. But because we don't have enough donors that match up with the people who are highly affected by sickle cell disease, that's one area in which we are lacking. So in September, we'll be rolling out a Be the Match, and we need donors. So we need people to sign up to be the match donors. And at the beginning, you just do a cheek swab and you send it back in. And then they'll put you in the registry, basically. And then if somebody matches up with you and they need a bone marrow transplant, then there you have it. That's where Be the Match comes into play. So we've got a couple of activities that are going on for the next 60 days or so, because September will be huge. We're just coming off of World Sickle Cell Day. But in terms of, how in other ways people can help us, is one, to educate yourselves, of course, and talk about it. That's one of the major things that people don't do, is that they don't talk about sickle cell disease until it happens or until they know somebody with it. Well, at that point, it's kind of too late. We want to get these conversations going, and especially in our healthcare community. I really, really need the healthcare community to chime in and to do their due diligence. And I'm always available as a resource to help teach them. If they don't understand where to begin with sickle cell disease, or if they don't have any materials already pre-planned or how to approach this, I am always available to help fill the need and fill that gap, providing at sickle cell disease education and outreach in the community.
Last question is the easy one then, is where do we go to reach you? So website, social media, phone number, where would you direct us?
Sure. I would say that you can go to our website, www.bsboy.tsscycle.org. And that's also a great educational piece. We're a great starting point to learn about sickle cell disease. And also you can check us out on our Facebook page, Instagram. They all have the same handles, at Break the SS Cycle. And you can keep up with our latest happenings and what's going on in the community. And feel free, if anybody wants to email me and share a message, it's www.btsscycle@gmail.com. So that's our email address.
Well, Dr. Scott, greatly appreciate all you're doing, you and your team, and appreciate you coming on the show. Thank you very much.
Thank you very much for having me.